Welcome to the Capital Integrative Health Podcast, a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. I am Dr. Andrew Wong, co-founder of Capital Integrative Health, an integrative practice committed to expanding access to holistic root cause medicine to the global community. Today we're joined by our friend and colleague, Dr. Kim Baer. Dr. Baer is a biological dentist and is passionate about providing quality dental care that does not come at the expense of overall health. She offers innovative care that is free from toxins, bisphenol A, fragrances, and fluoride. Dr. Baer's areas of expertise include holistic services like ozone therapy, safe amalgam filling removal, natural orthodontics, and non-metal zirconia dental implants. We are excited to bring you a conversation about biological dentistry and how oral health can affect your overall health. Welcome, Kim.
Thank you. Thank you so much for having me.
And Dr. Baer is a biological dentist, but I also know her as Kim because Dr. Baer, or Kim, is also my dentist. So I'm very happy that you're here and grateful that you're taking care of my oral health as well.
Oh my gosh, I remember when you first started seeing me and you were so young. It seems like another lifetime ago.
Yeah.
We were both starting out. Yeah, that's great. It's been great to watch you grow. It's really, really been amazing.
Same for your practice. It's great. Now you have Jennifer with you,
Yep.
and you have amazing staff. Just giving a shout out to our dental hygienist. That I see Kelsey there. I know you have a lot of great people.
I'm very blessed. I have a lot of great staff.
Yeah. So we can talk more about that. Well, I think first to start off here, Kim, let's tell us about your background and introduction to dentistry, as a whole. How did you get interested in dentistry and then specifically more holistic dentistry?
Well, to be completely honest, if someone had told me I was going to be a dentist in college, I probably would have been offended. My older sister is an osteopath and became an OB, and she was doing her residency, and I was getting ready to take my MCATs, and she was like, "Don't do it, man. Do not do it. School's the easy part. You're giving up your life." She hadn't been home for the holidays in 7 years. And she scared me. And I was hearing about her bad days, which are really sad and hard. I knew I wanted to work with my hands and I wanted to help people. And I really didn't know what to do. My friend said to me, "You should be a dentist. The hours are really good." I work at a dental office.
Nice.
So I went into dentistry, but I had no idea at that time that I would be practicing the kind of dentistry I'm doing now. It's been an amazing journey and definitely more interesting than I ever thought it could have been.
That's awesome. Well, and so we all know, I think, what a dentist is, what a dentist does, obviously take care of the mouth, the oral health. But what is biological or holistic dentistry? Let's kind of talk about the basics of that first.
Well, a lot of people will use these terms, but the training is really hit or miss. So biological dentistry is basically like biological medicine or functional medicine is really looking at the whole system. In this country, we chop things up. I love this country and I'm part of it, but we chop things up. Like in dental school, I'm only allowed to look at this, or I'm only allowed to look at feet, or I'm only allowed to, none of them are connected. We learn a little bit here and there, but honestly, it's just one system. Everything. Once I learned and I realized that everything I was doing in someone's mouth, whether it was a little filling or a cleaning, was affecting everything. It's a little overwhelming. There was these moments where I wish I didn't know, because once you know, there's no turning back.
Right.
Once you start to look at it that way, it really changes the way you treat people and potentially the type of treatment you would give a patient, because you really are looking at their overall health and what their body potentially would work well with and what it wouldn't work well with.
So connections versus silos, I kind of think of those Iowa grain fields with a bunch of silos, and of course none of the silos are talking to one another, although we know that our bodies are connected.
Yes.
How would biological or holistic dentistry, it looks at the whole person and how everything's connected, how does that differ from conventional dentistry? If you could give our listeners a bit of an example of how that approach would be a bit different.
For example, we look at what materials we're using. Like, we're putting something in your mouth, which is part of your GI system. It's the start of the tube. So it's very important. So just like some people have sensitivities to different things, whether it's pollen or smells or metals. So we look at that person and look at what materials they would do well with. I think it's kind of crazy that we don't look at that with everybody. And if we have a patient who's very sensitive, we will do biocompatibility testing, which is a blood test where we actually send it out and they will look for sensitivities. So with all the dental materials that are used in the United States. So what I tell my patients is it's great to get this test results and it will say, list them all and it will say what's good and what's bad. But the most important thing on that list is what's bad. That's really the key right there.
So the things that are bad you would avoid putting in someone's first part of the GI tract, the mouth.
Exactly. Because a lot of times if you use, whether it's a cement or a filling material or a crown material, it might not show up in that area that there's a problem. But if this patient has inflammation issues, it's just going to be like, it could be a trigger or a straw, and it can create all kinds of issues systemically. So, it's all connected.
In functional medicine, we talk about the straw that breaks the camel's back, right? And so, we keep on putting straw after straw, allergies and toxins and maybe non-biocompatible, filling material or things like that. All of these things can contribute to inflammation.
Yeah, I use that phrase all the time. In the table, your body is a table, and our entire life we're putting stuff on there, toxins. And most of us are okay at detoxing, and we can start getting, some of those we can clear every once in a while, but eventually it's going to build and build and build, and your body's going to say no more.
Mm-hmm, mm-hmm.
And that's when you're going to start they'll say, oh, I have been using this material or this product for so many years, I had never had any issues, but now your body's saying, I'm done, and then, so it doesn't, just because something was okay in your 20s doesn't mean it's okay in your 30s or your 40s.
And that point can't be overemphasized enough. I believe, if you're putting something in someone's mouth that's going to be there long term, potentially for the rest of their life, and it's not biocompatible, then that could really be something that's an ongoing low-level trigger that's causing inflammation.
For sure. And that's what we try to avoid.
And I think another question we have, along with biocompatibility, is what minimally invasive technologies do you use in more biological dentistry?
So as far as minimally invasive goes, we're all about only extracting teeth if it's really necessary. And a lot of people will extract teeth for orthodontic reasons, and we're kind of against that. And then we in our office, we use a laser, which allows us to do many procedures, surgical, different things, and remove the minimal amount of tooth structure.
Well, orthodontics, just to get back to a non-expert like myself on this, what would that mean? So if someone conventionally is going to extract tooth for orthodontic reasons, what does that mean?
So we know, and there's a ton of research, and you can Google it. It used to be, they'll extract premolars on kids or even adults to basically be able to move their teeth in and line them up. When you do that, first of all, 98% of the cases will always have some sort of TMJ issue. And it's because at that point, you're not only making the jaw smaller, you're pulling back and you're compressing up around C1. So you're doing this, which will lead to sleep apnea down the road. All kinds of airway issues, less oxygen, and it's just these people need to be expanded, not retruded.
Is that very common nowadays still?
You'd be shocked.
Yeah, I have no idea.
I mean, that's not all, it's, I think the education is out there, and I think things are changing, but you'd be shocked.
So it's still happening where people are just removing teeth just to make them sort of get an alignment, but that's not really getting to the root cause.
No, it's a quick way of lining your teeth up. It's much quicker and easier to do that.
It's kind of like with surgery sometimes, like this subcutaneous belly fat liposuction, which doesn't do anything to visceral fat inflammation.
Yeah, I'd love to hear your thoughts on that. That's super interesting.
Well, just as a tangent, that in theory will make people look better and the contours better, but it really doesn't do anything for C-reactive protein or these type of things.
Yeah, it kind of makes sense.
Yeah, exactly. Well, let's talk about some of the I would say, meaty aspects of this podcast here. How does, we might allude to Weston A. Price a bit here, but how does dental health affect health overall? So we listed some things here to chat about, but you can feel free to really dive into any area you'd like. We talk about how there are potentially connections certainly between, dental health and certainly gut issues, makes sense, but also overall inflammation. Maybe we'll start with that, and then we can kind of go through some other things that you might think are relevant here.
Yeah, so there's, in my very humble opinion, so as far as inflammation goes, you can look at the tissues and infection in the mouth, which is huge with that. And then also, though, when we look at someone with like a small airway or sleep apnea, or not getting enough air, or breathing through their mouth, they're not a nasal breather, their mouth is going to be inflamed. And overall, they're usually very inflamed, generally systemically. And you'll hear it's the same issues. These people have the same issues. It's usually, I'm seeing your list here, it's hypertension, ADD, sleep apnea, fatigue, migraine headaches. And they almost are all sort of wrapped together, and you see this whole connection. So we've definitely seen huge results with getting that inflammation down. But sometimes a patient will come in and there's something that we can do as far as periodontally that is just an issue that we can correct, whether it's been, just keeping up their hygiene, getting their hygiene better, and getting them on a better biocompatible products if they're going to use products. Because sometimes in this country, we feel like if it doesn't burn or bubble up or it's not working.
It's not a real thing.
I know. It's not clean. It doesn't hurt. So
no pain, no gain.
Yeah. So it's actually the complete opposite in your mouth. Yeah. So once we correct even one of these things, you'll see all kinds of interesting. But a lot of times you can keep going to the dentist every couple of months and do cleaning. If you're not breathing through your nose and your diet is wrong, or your airway's too small, and you're just not getting enough air, that inflammation, you're never going to get ahead of it.
So the mouth, when it's too crowded from either developmentally, genetically, or acquired, there's not enough oxygen getting to the entire system, to the brain, to the rest of the tissues. Mm-hmm. And then maybe we would see some of these medical issues that we see in healthcare overall. Hypertension, sleep apnea, these things, fatigue, ADD,
yep.
Right? We need oxygen for our lives, not only to survive, but also to thrive. Like someone could be walking around upright, vertically, but they might be a little, sleepy, or they might really not be all there. And we think that, maybe oxygen has a big part to do with that. Oh,
for sure. I was tired all the time. I definitely had oxygen issues. I was like, I could sleep 12 hours and still be exhausted. It was, you can diagnose as ADD or, because it comes off in all kinds of different ways. But yeah, if you're not getting enough, what is it, the rule of, is it threes? It's like 3 days without water, 3 minutes without oxygen.
It is pretty close to that, yeah. You basically, I think there are people that can, Corey is one of our acupuncturists on here, and he does the Wim Hof breathing, so I'm pretty sure he can go, more than 3 minutes, but he's a stud in that regard. So, got the 3 minutes plus oxygen, but it's definitely something, typically.
Yeah, typically. So, once we, and I see a lot of patients where they'll come in and they'll have these long-term chronic infections in their mouth, whether it's around a root canal tooth or just a tooth that's dead, and they feel nothing. I could tell you so many stories. They feel nothing. They had no idea. And that's why one of the things my patients, I totally understand, are, radiation. There's issues with getting x-rays taken, and you want to be careful with that. One thing has been great with dentistry in the last 22 years since I've been practicing is everything's gone digital. So one dental x-ray is like a tenth of what one old dental x-ray used to be radiation-wise. There's pros and cons to that. We don't see as much detail because there's less radiation, but we see enough. And these infections, that's the only way they can be seen. And these infections sometimes can, you'll have lymph node issues, people are being treated for these much bigger issues that their doctors are concerned about. And you guys have no idea this person has a huge infection in their jawbone because there's been no pain, no one's found it.
Now, are the x-rays that you take to screen for infections like, cavities and other chronic dental infections, is this something done in conventional dentistry overall?
It is. It is done in conventional. The only thing I would say is, sometimes certain areas aren't x-rayed often enough, or for instance, some dentists don't use a 3D imaging, which gives you a lot more of that. So even though the x-rays of the teeth are being taken, some x-rays only really show you cavities. They don't show the whole jawbone. So that's where you can be going to your dentist regularly. And if they're just taking those x-rays looking for cavities, they're not going to see anything else.
Yeah, just the tip of the iceberg.
Yeah.
Yeah. I use that analogy a lot in our practice here. Kind of like that Titanic. It's like, oh, there's just a little piece of the iceberg, but there's a lot more.
It's so funny. And I use that all the time as well.
Yeah.
Yeah.
That's funny. Well, we can talk about, let's talk about migraines and headaches a bit, because, I know we see a lot of people with migraines and headaches and TMJ in our clinic. So how is that related to mouth health and just overall?
So I have to say, tons of theories, and over the years, I used to suffer from them. I've done the Dawson training, and I've done a gazillion different other occlusion trainings. And what I've come to find is it's really about compression in the joint, which is usually a jaw that's been pushed back a little too far. And we can see it on the x-rays, and you have a tuberosity by C1, and if the angle of your mandible should be about 4 or 6 millimeters in front of it. So a lot of these patients, it's like here. So
in the C1?
Yeah.
Okay.
So what they're experiencing is there's compression there. So they're getting, they're getting fluid buildup, inflammation, there's poor vascularity. So it creates this whole domino effect.
So you're saying that poor oral health and a jaw that's too far back is actually compressing the cervical spine and causing headaches?
Yeah, for sure.
Okay.
Yeah. And then if they have that, then I can tell you right now, because if you were to look on a diagram, and if we had a 3D here, I could show you, they would also have, when they lay down at night, they'd not be getting enough air either.
Oh, wow.
So they might not have sleep apnea. The funny thing is sleep apnea is such a key word. I remember my father died of cancer a few years ago. He snored like a truck. And we kept sending him for sleep studies, and they kept saying he's fine, he doesn't have sleep apnea. He didn't have sleep apnea. What he had was severe upper airway resistance disorder, which actually is worse.
Oh, wow.
They're saying because it's chronic low oxygen saturation for the entire sleep. And so you're getting less air, because if you're snoring, something's blocking it. So you're getting less air for the entire time, instead of just, you might not stop breathing, you're just getting less air.
Time to get those sleep studies,
I know.
to diagnose this, because we've diagnosed this a lot in our practice as UARS. Did not know about it before.
And with women, I started snoring like crazy, like right before I turned 40, and my daughter, who's now 12, told me, she's like, I don't want to sleep in your bed anymore. She would sleep in my bed sometimes. She had a bad dream. She's like, I don't, because you snore. And I was like, I do not snore. I've never snored. And, once your hormones start changing and that soft tissue starts to drop a little bit, that's when you'll see, I always had a small airway, but my tonsils and adenoids were removed when I was 3, but it wasn't until my hormones started to change. And then.
Is it the estrogen, or what is it that is?
I always thought it was the
progesterone.
I always thought it was the testosterone.
Okay.
But I'm a dentist.
I'll have to look that up.
So,
yeah,
you
I'll research that. Yeah, we'll talk more about that. Great. And then I guess TMJ would also obviously be affected by dental health as well.
For sure.
How many people do you see in your practice that have either sleep apnea, frank sleep apnea, or some sort of upper airway resistance syndrome? Because I know you work with also Dr. Manny Kim.
Yes.
And work very closely with him. So, what is your percentage you think that you're seeing in your population? 100%.
I know.
It's pretty high.
People get tired of hearing about this, but it would be easier for me to pick out the people who don't.
Yeah.
I'm always impressed by them. I'm always like, ooh.
You don't have
You have
UARS.
a nice airway. Yeah, like.
So what's the root cause of all this? Getting to the why of medicine here.
I think it's generations of extractions, bottle feeding, diet. Because when I travel overseas, and for instance, I haven't gone last 2 years, but I was doing a trip to Haiti every year, and I'll tell you what, their diets were no processed foods. I mean, I usually go to these places and there's a lot of processed food diets because it's cheaper to eat that. In Haiti, it's actually not available to them. So they're really eating like fresh food. Not a lot of it. No one has any body fat, but that's what they're eating, just not a lot of it. But I'll tell you, structurally, like jaw-wise, airway-wise, when I'm working on them, I'm always like so jealous. Just beautiful airways.
Is it kind of like weightlifting, where if you keep on lifting weights, doing push-ups, your muscles get stronger, your jaw and your airway might get a bit stronger, wider if you chew foods that are not as processed, that are not as soft?
Yeah, but yes, I would. But I don't know that I can't tell you how much it would help you if you did that, but I think it would help any children you would have.
Yeah.
So like I think so we've gone down this path for many generations, and our skulls we're getting smaller and smaller, especially in this country. And you'll see it in other areas, it's not the case. But so hopefully we'll start to reverse that.
Yeah.
So I look at my patients now who I'm actually doing that on. We're using growth appliances to grow them out. And I always think to myself, I won't be around, but it would be so amazing to see what their children's jaws look like.
Yeah, start with the children.
Yeah.
Yeah. And you treat children in your practice?
Yes, we do. With Dr. Tipograph, yeah.
With Dr. Tipograph, yeah. That's great. That's great. What is the earliest age you treat there?
So we like to, first of all, we just love babies. So we just look for an excuse for our patients to bring them in. We're like as young as they can come in and actually just sit there. So a lot of times if they're really little, we'll say bring them in when you're getting your teeth cleaned so we can just take a look, or just to get them comfortable in the office. You don't want their first time in a dental office to be like when a tooth gets knocked out. You want it to be considered a fun place to go. Mm-hmm. So that's what we usually tell them.
Of course, I remember loving the dental toys and the video games we used to play, going to the dentist. Yeah. Makes it a fun experience.
I always had positive experiences at the dentist.
Just officially from the ADA, what's sort of the official, like, when should kids start going to the dentist?
Oh, the ADA, huh?
Or let's just say for your recommendation, maybe not the ADA.
I think they say... I don't know. I don't even want to guess on the ADA thing, but usually I think a lot of people say commonly is, age 3.
Yeah.
Or like, some people say as soon as, they've erupted a few teeth. It's really, there's a lot of different philosophies on that. I don't think you can go wrong.
And I like to say also, look at the guidelines, but also use your brain and, use your intuition about, health in general. So I think that's great for the listeners out there. What are some long-term effects of infections in the mouth? We talked a little bit about dental health and overall health, but, we know that there's an oral microbiome in the mouth. We talk a lot about the gut microbiome.
Yeah.
But of course, the mouth is part of the gut. But there hasn't been as much research. I think there is more research now being done on the oral microbiome. Mm-hmm. What's the effect of what we would call oral dysbiosis or oral microbiome imbalances? How does that affect your dental health and overall health?
Yeah. So once again, I'm going to say I'm a dentist. Okay, because I don't get a hand slapping on this one. I can say that there's a lot of research out there. I mean, clearly one thing we do know, which is funny, that the heart surgeons are a little ahead of. Have been, since I've been practicing, they are hardcore about the mouth and the heart. They know there's a ton of research that shows you. Now, there are also a lot of research out there saying, for instance, like if you had a hip or a knee replacement, the same bacteria, if someone has periodontal disease or an infected tooth in their jaw, like I was talking about, like an infected old root canal or a tooth that's died, they don't feel that when they culture that rejected implant that they put somewhere else in the body, they're seeing the same bacteria that they would culture out of the mouth. So, surgeons know this, that they don't want their patients coming in for surgery unless everything in here is good. That tells us there's a lot of research out there that shows how if this is not good, it's going to affect everything. It definitely, and there's like a lot of really interesting research coming out now showing like even just the effects of your oral health on your mental health. Because we're learning, people say, oh, a psychological event or a psychological issue a patient might have maybe isn't physical, but now we know it actually is physical.
Absolutely.
So it's all, it's all connected. I like the way Dr. Manny Kim, I quote him all the time. And he's a PT, does a lot of osteopathic work, and his philosophy is he thinks the mouth and the jaws are super important. He calls it the top of the zipper. So when this is imbalanced, either structurally or even bacterial-wise, it's as you go down, it gets worse and worse and worse. So, when you're zipping up your coat and it's a little off, and then as you go down, it gets worse and worse and worse. So he is all about getting this fixed so that he can work on stuff further down the chain.
That makes sense.
I know.
Yeah.
He's so smart.
He is, as you are as well. But I know there's also some research, I believe, not mistaken, that there's some research between Fusobacterium, which I believe is one of the potential, colonizers in the mouth, and colon cancer or colon pathology. And we do see that sometimes on the gut test that we do. There's some Fusobacterium. So if we see that, we might say, hey, go see your dentist,
Yeah. Oh, that's awesome.
Yeah.
I love that. I'm telling you, there's been so many cases where we've removed on patients, I can't tell you how many patients have come in that have been, recovering from breast cancer, or, had the treatments and are okay. And then we look at their jaw, we do a 3D, and like, oh, you have 4 infected root canal teeth, and then we go in there and clean it out. But I always wonder, I wish this had been found earlier. I can't, but all I can tell you is that's a lot of white blood cells keeping those little chronic infections. So it's a burden on your body. And so when we clean one of these out, I can't make any promises systemically, but I can tell you that it can only help.
You're cleaning out the system, maybe unburdening the immune system so it can concentrate on the entire body.
Exactly.
Yeah,
it's sort of wasted energy.
Yeah, it's not needed there if there's no infections there. That's great. So there's a lot we could talk about, for that. But I guess we could start also talking about just going back to the mouth breathing, because that's so important. People should breathe through their nose. You're going to increase the nitric oxide there. It's going to be a better breath, pound for pound, so to speak, nose breathing versus mouth breathing. Why do people breathe through their mouths? If they, maybe people don't know that it's, or it could be they have sinus issues or something.
Oh, yeah, for sure. So people come in all the time and they say, I have a deviated septum. Everybody's got deviated septum. So if you take your thumb and you put it up on the roof of your mouth and it goes up like this, it should not do that. So that's called a vaulted palate. The roof of your mouth is like this.
I'll do that after this podcast.
Yeah. So it does this. It shouldn't do that. It should be like this. Not completely flat, but almost. And so when it does this, it usually goes a little to one side or a little to the other. And it's literally sitting in your sinus, where your sinus cavity. So it's blocking this one side or the other usually. I ask the person right or left, it's like this little interesting thing I want to do research on. Because it grows up into the less dominant side. Usually if you're right-handed, it'll be on the left side, or if you're right-handed.
So you said if you take your thumb up, it should be flat?
It shouldn't be like this.
Okay.
It shouldn't go up. You should put your thumb in, it should go like this and touch the roof.
And if it does go up like a tenth, then what does that mean?
So it's called, you have a vaulted palate, which is super common. And that is, the roof of your mouth has grown like this for many reasons. One reason is a lot of times when people do orthodontics, when they're young, the wires, the way they are designed for retraction. So they don't ever really let the jaw go out. They sort of hold them there when they're 12 or 13 like this. And so they never get their potential of going out. So when that happens, the roof of their mouth, they're still growing, can't grow out, so it grows up.
Oh,
Okay. So to get air, then now you're using your mouth because you're never going to get enough air out of your nose. Like I love the lip taping, all that stuff. But it's a problem if you can't get enough air through your nose. It's going to be a constant struggle. So that's, or it could be someone who thumb sucked for a long time and put that pressure up there.
Now, is there a way to reverse that vaulted palate?
Yes. So that's what we do with the growth appliances on adults and children. So reversing that, especially children, you don't get the feedback by, they're so easygoing. But with adults, they'll tell you right away after the first month. They're like, oh my gosh, all of a sudden now I can get all this air because it literally will pop down a little bit. So so we want to increase that air through the nose.
So the growth appliances are the ALFs or?
Yeah, ALFs. There's a Vivos appliance. There's a Leal appliance. There's many different ones.
Right. Dr. Lau is local in this area, I believe, yes.
Yes, he's a good friend of mine. I love him. I
saw
love
him at a
Felix.
networking event, a functional networking
Felix is
event
great. You should get him on here.
Yeah.
He's
Planning
a talker.
to. It's awesome. Okay. All right. Nice. All right.
I'll give you a
Felix.
cell.
Yeah. Awesome. Okay. Sounds good. Yeah, I'd love to have him on too. Let's talk about a big topic that I think is really, there's a few big topics that we want to also hit on here. One is amalgam fillings, which, back in the day, back in the 80s, when I was, had some fillings and everything. And, that was kind of standard of care, but, they were called silver fillings. And of course, silver sounds really sexy, really great. Like, jewelry, silver, gold, platinum. Hey, what could go wrong? But my understanding after looking at it more, recently, it's like, silver fillings are really mostly mercury fillings. So
very
why don't they
silver
call it
in it.
mercury
There's
fillings?
Very little silver.
Right.
What is it, like 2 or 3%?
It's very little. I think the majority is mercury. And so, I got them out. I got them replaced with some biocompatible, either porcelain or other things. But how do you approach removing fillings? And if you'd like to talk about, I don't know if you want to talk about this, but either what is the underlying reason why we're still using amalgam fillings in this country? So
I think the approach of removal has been pretty much optimized, at least as far as we know, by the organization, the IAOMT. So and they've really put together a lot of research and have, as far as filtering and the way they should be removed, basically just so they can be removed without as little off-gassing as possible. So I can actually sometimes get one out without even touching it. Like you can go right, there's like little techniques to that. So there's a bunch of equipment and stuff we use. And it's just about minimizing your exposure to it when it's removed, which is definitely the way to go, especially if you have a lot of them. But as far as why we're still using amalgam, I think it's very cheap and it's very durable and it's very easy to place. So you'll see it used mostly now in like HMO practices. A lot of insurances will only pay for amalgam fillings because that's cheaper than a resin or a porcelain one. And then you'll also see it like with a lot of special needs patients where it's very difficult to potentially isolate the tooth because these other materials like that I use in my office, you have to keep it very dry to put these other materials in. And with amalgam, it doesn't need to be dry.
Okay. So easy, cheap, convenient, but not necessarily the best for your health.
No, not at all. Not at all. I learned when I was in dental school way back in the early 90s, that's what I learned to do.
Yeah.
And I loved working with I could do a really nice amalgam filling. They're fun. You carve them. I mean, you can do and they last a really long time. But yeah, no, you can't. You shouldn't use it. Mm-hmm. That's my opinion. There's too many great options now.
And we know that mercury is associated with immunotoxicity, neurotoxicity, chronic inflammation, allergies, autoimmunity. I mean, the list goes on and on.
There's no safe amount of mercury.
Right.
So like I remember, and I don't know, I might have talked about open up one of those capsules in lab, working with my colleagues in dental school and looking at that little ball of mercury. It's a big ball of mercury. There's just as much mercury in an amalgam capsule as there is in a thermometer, like the old school thermometers. But if you break a thermometer, they clear the area and people come in with suits, right? And people say, it's different. It's not different. It's the same thing, okay? But I'm going to shake up this thing. I'm going to break it, put it in there. I mean, I mean, I understand for a long time it was really the best thing we had. And I think, I think who knows in 10 years, I mean, the porcelain material we're using may be having the same conversation about. But I think that's all you can do, though, is, learn and grow and try to get better.
Mm-hmm. Yeah, exactly.
And I think we are.
Good. That's very helpful to hear. Yeah. How does your approach to removing amalgam fillings maybe differ from a conventional approach? It's based on that IAOMT organization protocol. What does that stand for, just for the listeners out there?
International Academy of Oral. What's the M? Something toxicology.
But you are trained in this, which
yes.
is which is what I was trying to get out here.
Yes.
Not try to put you on the spot, but
yeah.
And so this is an organization that's kind of like the IFM, the Institute for Functional Medicine, where it's biological dentists are trained and how to safely remove amalgams, and just also on probably biologic dentistry principles in general. Yes.
Yes. We actually, we do a lot of training, though, not just with them. Like, we do training with other organizations, like Dr. Volz's organization in Switzerland.
We'll talk more about that. Let's talk about that another time.
Okay,
yes, that sounds good. So let's talk about sleep apnea a bit, because just going back to that, we know that sleep apnea, there's different ways to treat that, and also upper airway resistance syndrome. But let's say sleep apnea, we have potentially there's CPAPs, but a lot of people, the statistics on CPAPs are that 30% of people after a year take off their mask and they don't return to it. They, only would I say 30%? 70%. That means 30%, only 30% tolerate it after a year, which is basically 7 out of 10 people put away that mask and just put it under their bed, and then they don't use it. Even though they have sleep apnea, they have a treatment for it. They have a good treatment for it, but they're not using it because it's not comfortable for them. Mm-hmm. So what are some other ways to treat sleep apnea that you kind of can offer from a biological dentistry or holistic perspective?
So there's two things you can do. Many of my patients have CPAPs and want to get out of them or can't tolerate them. Is we can make appliances that literally sort of hold your jaw forward at night and keep your airway open. And depending on where you're at in the scale, as far as like mild, moderate, or severe, that works well for like mild to moderate. It actually can work very well. But if you want to fix the problem, the two ways that is structurally fix your airway by opening it up would be a growth appliance. And then also what we like to interlace with that, or potentially some patients only need, is we do a laser treatment, which is called Nightlase, where we basically are lasering the back of your throat, and it takes that tissue back there and tightens up the collagen until you see this soft tissue that's sort of sunk down, and it'll go. It's like, so it sounds terrible and painful.
I think it sounds cool. It sounds like night laser tag to me. So it's kind of,
I've had it done on me. You don't feel anything. It's actually very boring. You just have to sit there for 20 minutes while we do it.
So you don't feel pain?
There's zero pain.
Okay.
But you will, you have to do it like every 21 days, 3 times. And it's something that, sort of like if you were doing Botox for your face or something, it's something that you would have to do once or twice, a few times a year to sort of maintain it. Mm-hmm. So a lot of our patients will do the appliance with the laser because that sort of opens things up immediately. Or, some will do one or the other.
Got it. And what about the upper airway resistance syndrome? How do you treat that?
Exactly the same.
The same way. Okay.
Exactly the same. The laser is amazing for that because that gets rid of tightens up the tissue. And the appliances knock that out as well. That's how I fix myself.
Got it. Nice. Awesome. And how about with the myofascial release? Where does that come to play with these treatments?
Oh, yeah. So we work with Dr. Manny Kim, and he's amazing. And he will basically before we do either of these treatments, I have my patients get evaluated by him. I work with other PTs in the area also, like Louise Kelly, and outside the office. But we have him in the office like right now on Thursdays, and he will evaluate the patient, structurally, and then we sort of like discuss what would be the best way of treatment, like that they would get them. Sometimes it's a matter of him doing some structural work on them before we get started. Depends what they have going on. Because So it can be the right treatment, wrong time. And the nice thing about all these treatments are you can do them at any point in time. I have patients in their 70s doing these growth appliances, and you get the same results. So it's, and I don't know what we'll be doing new in the next 5 or 10 years, but it's nice to know what your options are.
That's brilliant. So it's never too late to change your mouth.
Late.
Yeah.
Epigenetics, Andy.
That's right.
Epigenetics.
I'm totally for that as well.
I'm constantly changing.
That's right. Our cells are turning over every 30 days or even less time, depending on the tissue, I believe. So that's great. Thank you so much, Kim. We're going to talk about a couple other things. I'm curious your thoughts on nutrition and oral health. A great topic. Everyone's all interested in nutrition, and how does nutrition affect oral health? I would say, we know that nutrition can be one of the root causes, one of the reasons why there's some epigenetic influences on the mouth health, on the jaw diameter, and everything.
Yeah. If I could take all my patients and put them on a anti-inflammatory diet, I think I would probably cure 90% of it, everything they have in their mouth.
We're not talking about 16 tablespoons of olive oil a day, right? We're not just olive oil, but other things.
Like a whole lifestyle.
Yeah.
Like, I like to talk. So a lot of, I have some patients where, like, for instance, soda is a problem. Like, if we're looking at teeth and cavities, that's like number one.
It's got to be the worst food for teeth, right? Sodas
it's the worst.
Phosphoric acid and all that.
And so I remember I used to love Diet Coke back in the day and in school. And when I got out of school and I started working people's teeth and I started to see these Diet Coke drinkers, their teeth, I remember I'd be like, okay, I'm going to let myself have a Diet Coke when I go to the movies. That was the only time I'd let myself get like a big Diet Coke. And then a few years later, I'd go to the movies, get my Diet Coke. I'd take one sip out of it, and I was like, oh my gosh, my teeth are killing me. It was psychologically, I couldn't do it anymore. So I saw so much.
Yeah.
So soda's huge. But you know what? I have so many holistic and healthy patients where it's not soda, where it's actually like juice.
Yeah.
People think it's okay, but...
And juice is not really great metabolically for you anyway.
Sugar.
In theory, if they drink it through a straw, though, would that help the teeth or no? No, okay.
Because it gets in your saliva.
Okay.
It's the pH.
Okay.
Yeah. I mean, it might decrease it a little bit, but it's still, I would recommend if you're going to drink some juice. I'm not anti all juice, but if you're going to drink some juice, I would follow that up with some water.
Okay, just to wash it down.
Yeah, you don't want, and then people think when you're drinking or eating something acidic, you don't want to run to the bathroom and brush your teeth. Your teeth are actually very soft at that point, so I would just drink some water.
What about the classic club soda, the juice with the orange juice with the seltzer?
The problem with that is it's the pH. It's a carbonation that gets you.
Okay.
So that's why, like, even with soda, diet soda is actually worse than regular soda.
Yeah.
The pH is even worse. So, yeah, it's just the pH.
And because Weston A. Price was a dentist, and he wrote this whole book on nutrition, and I think it was called Nutrition and Physical Degeneration, I believe, or Oral Regeneration. I'll have to go look at my Amazon cart. But he wrote this whole book on nutrition and oral health, and went around to all these indigenous societies, and they were like, eating super healthy, whole foods, but they were varied on their nutrition. Some people were eating like mostly meats and even like blood of the animals and things like that. Other people were eating mostly like yams and stuff, but it was all like whole foods that they were harvesting locally or hunting and harvesting locally. And all their teeth, I mean, apparently from this book here, very famous book, is that it's very much, these people, these, tribes or the cultures were very, that had very healthy oral cavities.
So even with juice and fruit and stuff, like with his research, he showed, a lot of these, especially out in the tropics, that they ate, but they did it seasonally. So like this fruit was in season for a few months, so they ate a lot of fruit during that. But that was it. So like now we have we have too much access. We can get pineapple every day of the year. We can get, every day. So it's excessiveness. Yeah. Really.
And it doesn't allow the body to recover and kind of change with the seasons.
Yeah. So, I don't know. One of the things I love about him is he talked about, with all of his research, that there's this mineral activator or vitamin activator thing in all of his research. And he wasn't sure. He gave it the name, I think it was Activator X, or it was X. And he compiled all this research on it that he felt like this thing he called Activator X was the one nutrient that was key to transporting all the ones you really need into your system. And then I think it was in 2008, I cannot remember the researcher, but I have it in that book I just gave you, got together all their research, and he proved that this X thing was actually K2, and how that was, what we needed, to transport vitamin D into our skin, our bones. So like, there's so much research out there on, you should have vitamin D with vitamin K. You need it, or else it's not going to get into your skin and your bones. And they show how in this country, we're throwing vitamin D at everybody, but where's the K2 that they need to actually absorb it? Like, why do we have so much osteoporosis in this country? Because what does calcium need to get into your bones? Vitamin K2.
Yeah.
You know what I mean? Like, we're taking calcium, but we're not taking K2.
Yeah, so it's getting to the arteries instead. Yeah.
Exactly.
Yeah.
And so I've been following this, the Dr. Volt's approach with the teeth. There's a ton of research out there. He says if you have your vitamin D and K levels at a certain point, like you'll get it into your teeth. You'll get it into your bones. You'll see a decrease in periodontal disease and inflammation. And I have to say, so we've been working on this with our patients, and the results have been amazing. You see, even just completely opposite, the Orthodontics Society has seen, or if you're doing orthodontics on patients and you're moving teeth and stuff, there's D and K, and you're getting 30% more bone growth. 30%, which is huge.
Wow.
So, because a lot of people lose bone when you start moving teeth and stuff. So this is very important to not just have D, to have it with K. But you know more about that stuff.
No, I think that's a great point, is that, vitamin K, all the vitamins, all the minerals work synergistically with each other. It's not just like throwing one isolated vitamin out there.
Yeah, it's necessary to have that to pull it over and actually absorb it.
Yeah, that's a really great point. Yeah, we do try to recommend for people when they take the D3, take the K2 in addition to that, as well. How about mouthwash? Everyone's all into Listerine right now and all these different mouthwashes. Is mouthwash good or bad? What does that do to the microbiome? I think that's a good kind of place to start with that.
So there's so many options out there now. You really want to be careful with that. Like, we think more is better. My dad loved Listerine. It burns. But, you want something that's not drying, because that's going to destroy your biome, and it's going to destroy your teeth, and it destroys the materials we put in your teeth. So clearly alcohol-free, but I think a lot of mouthwashes have caught on to that. You don't want anything artificial in your mouthwash. You don't want anything artificial in your mouthwash. You don't want it to be foamy. You don't want it to be blue. Okay.
Like bright blue, like a non-natural.
Or red. Or I know, like I don't know what's in there, but
it's not strawberries.
You want something that doesn't dry your mouth out. Yeah. So less is definitely more in this arena. It's crazy that you've seen that research on the, people with high blood pressure. They took away their mouthwash and watched their blood pressure just drop.
No, I didn't know that.
Yeah, at NIH.
Wow.
So because they were destroyed, they had no nitric oxide in their system.
Oh, okay. So that might be something. And there are some nitric oxide salivary test strips that we use to, look at that, to look at the NO levels. And,
very cool.
But it might be interesting to see, if they have those low NO levels. I might start asking them now.
You just ask them across the board. Don't use any of that stuff.
Yeah.
So there's definitely natural ones out there I like that have essential oils. We have a few at the office, but you can get them other places. But honestly, I tell my patients the best thing you could probably use is water with like a little bit of table salt.
Okay.
Because that's what your cells love.
Oh, that's brilliant.
Not sea salt, table salt.
Okay, so not sea salt, so like the regular table salt?
You want iodide?
Iodized salt.
Yeah.
Okay, iodized salt.
And not a lot. Like, you could put a salt shaker by your toothbrush and fill a cup with water and just go shake, shake. And you would be shocked with how happy your gums would be.
I'm going to try that tonight.
Okay.
But I do like that one that you have at the office. I think it's called the Dental Herbal Company one. Yeah. Is that right? That one is so good.
Tooth and gum?
Yeah, tooth and gum. Yeah.
Actually, yeah, I had some jaw work done. This is like maybe 15 years ago, and I saw a colleague of mine up in Boston. I flew in for the appointment, and I went to his office, and he was a biological dentist. And this was before I actually done my training. And when I was leaving, I went in their bathroom, and they had it there in the bathroom, and I rinsed with it, and I left his office, and I got on a plane, I got home, and I could still taste it in my mouth, and it tasted good. And I texted him, I was like, what's the name of that stuff I use? That's amazing. And then, that's how he's got into it.
It is. It has a great taste, unlike many mouthwashes. I mean, it tastes like you're actually kind of rinsing out with some herbs as opposed to something.
And that's what you are.
A natural blue color.
And it's not drying at all.
Yeah. And what about toothpaste? Do you recommend, what kind of toothpaste do you recommend for people?
I like fluoride free, and two things, no fluoride and no SDS, like sodium lauryl sulfate.
What's the deal with fluoride and SLS? Why are they so bad for the mouth?
Well, we all get way too much fluoride. It's in our water. We don't need any extra fluoride. Well, you're not supposed to ingest it.
We're already getting fluoride anyway.
I know.
But should we, though, even get fluoride in the water? That's a whole other topic.
So
opening up a rabbit hole there.
You don't need any more. You have enough fluoride.
Yeah.
So I say no fluoride. And no, and the SLS is the stuff, and like they put it in shampoo and soap, and it's the stuff that makes it foamy and fuzzy. But you'll see if you go really high end, even with hair supplies, they don't put it in there because it's damaging to your hair. It's dry and it's no good for you. It's very reactive. So, and it's in toothpaste. And it takes a little getting used to not having it in your toothpaste, but especially patients who get like canker sores or any kind of, even like herpetic lesions, like that stuff will make you get it more often. It's very irritating. Your body does not like it.
So the SLS is there to make people buy the product more, essentially?
Yes.
It doesn't have a health benefit?
Zero.
Okay.
Negative.
That's important to know.
Bad.
It's like, because it's in all the shampoos and toothpaste, so it must be good, right? But
Yeah.
it's not. Yeah. Okay. Got it. All right. Well, thank you so much, Kim, for this and very enlightening podcast on dentistry, oral health, and how that affects, of course, general health. We're going to ask some closing questions that we ask our guests here, which are really amazing, and I think I'm going to take a look here. But, do you have a morning routine? If so, and, it could just be, I was watching this funny Netflix show on it's very random, but it's called Awake, and like people are awake for 24 hours. I watched that yesterday, and of course for them it's just like just rolling up and trying to hit the alarm clock,
Yeah.
And that was one of the games that was on there. But do you have any morning routine? And if so, I understand you are a very early morning person.
Yeah, I'm a morning person. I'm a runner, but I actually don't like to run in the morning. I do have a morning routine. It's very quick and efficient. Everything's out. I'm ready to go. The first thing I do is let my dogs out and get some coffee. And
you brush your teeth right after that, or?
I do brush my teeth right after that, probably before and after.
Nice. But, nice. I would expect that from a holistic dentist. Yes.
I know. You shouldn't do what I do. Just listen to what I say. But I have nothing exciting. I listen to NPR.
Yeah.
There you go.
Well, coffee, just to get back to that for a second, coffee is not necessarily, it's considered often now, I think with the research, like black coffee is considered a health drink,
That's what I tell myself. Yes.
Yeah, it has the chlorogenic acid, it reduces blood sugar, it has
I do really well with it. I drink it black. I do put some collagen in it.
Nice.
And it makes it less acidic.
Yeah.
But that's it.
That's a health food.
Yeah. So I just have black coffee with a little bit of collagen in it. No flavoring and nothing like that. So,
yeah. I've tried it with cinnamon. It actually tastes pretty good.
Yeah, that sounds good. I like cinnamon.
Yeah, just add a little sprinkle of cinnamon. What book or podcast are you enjoying the most right now? Maybe including your own podcast.
I'd have to say, I really love the podcast, The Holistic Vigilantes.
That's an amazing name. It's a great name.
They're amazing.
Yeah, so you and Dr. Tipograph as well.
Yeah.
How did you come up with that name? I kind of think about two women on a motorbike, brushing their teeth or something.
Well, we like to have fun.
Yeah.
Because, life is, all about stimulating the vagus nerve. We laugh a lot in our office.
It's all about laughing.
So, we take everything seriously, but at the same time, you got to laugh. So, we just wanted to have fun, and we thought that would be a fun name. And if nothing else, it would be a good clothing line, maybe.
Yes, I can see that. It's like a cutting edge. Yes, that's great. And what do you do every day to cultivate joy?
Such a good question. I don't know that I do the same thing every day, but there's definitely things, probably, spending time with my daughter. I like to go home and I go running, and I feel like it's definitely like a mental health, and I start off the run, and sometimes, I'm working out in my head, like I think about things I'm grateful for, because, you run and you go and your life is moving like this, and it's like, at what point do you really, like, you have to make yourself stop and think about it? It's so funny. Like, I'll be on a run and I'll be figuring some things out, and sometimes I'm really happy and I might cry a little bit, and I pass people and I know they're like, and then I come back. Don't mind me, just my therapy. So I'd say running, and then also I think the volunteer work that we do is actually the most joyous part. Yeah.
The volunteer trips to Haiti and other volunteer work?
We do locally as well. It's been difficult during COVID, but that, I feel like every healthcare provider, everyone should do it, really, because it just reminds you what's really important. Yeah. And it puts everything in perspective.
That's great. Yeah. Working for the free clinic. Yeah. That's so helpful.
Why am I really doing this?
Right. Being of service. And
exactly. And it's one of the things, isn't it one of the main things that bring people happiness?
Exactly. It is. Absolutely. Giving back when there's not anything expected in return, actually, is huge.
Yeah, I agree.
It's huge. Bringing that joy and purpose to life, and we know that's all part of health. Laughing, stimulating the vagus nerve. Now, we talk a lot about here in our practice about gargling too, and chanting and singing, and that's great for the vagus as well. So I'm curious, do you have any favorite songs that you want to sing at the top of your lungs? Not necessarily right now, but just in general.
I have some Sia songs that I will belt out in my car with my daughter.
She's a really good singer. Nice. You and your daughter, two-woman band there.
Yeah.
Well, Kim, thank you so much. It's been so fun and enlightening as well. How can listeners learn more about you and work with you as well?
Our website, we're naturaldentalassociates.com. You can find us, on the internet. And, our podcast, Holistic Vigilantes, which is on iTunes. Mm-hmm.
I'm looking forward to checking out more episodes of that.
Yeah, we're going to get you on it soon, I heard.
Awesome, yes. Yeah. I'm very excited about that, yes.
Well,
I think Jen is...
I know that you like the animals that we use.
Oh, yes, exactly. Thank you, Dr. Baer. Thank you so much, Kim, for joining us. And if you enjoyed this conversation, please take a moment to leave us a review. Okay. It helps our podcast reach more listeners. And thank you so much for taking the time to be with us today, Kim.
Okay, great. Thank you.